Just want to call out before I close remarks. I'm going to call out the GS1 UK Healthcare Conference that returns in 2025. Please save the date, 29th to 30th April 2025, and we're going back to the QE2 Conference Centre in central London, very close to the Houses of Parliament. Our event partner is BIP Solutions. We're very excited to be working with them, and I'll leave that there for a few moments so you can scan the QR code to register your interest, and that goes for anybody on this call, including solution providers, many of whom are our part of our GS1 UK partner program. So I'll leave that there while I just give some closing remarks. Now, the first thing I wrote down when looking through these slides is that Scan4Safety is alive and it's thriving here in the UK. And the term Scan4Safety was born out of the NHS procurement strategy and the demonstrator sites. And the term Scan4Safety is now used in other markets. So in other healthcare systems across the world, the term Scan4Safety is now becoming widely used. And we can see that the programs in Wales and Scotland are running ahead. There's now a dedicated team at NHS England. So all positive messages. And this success is due in no small part to the hard work from manufacturers to implement GS1 standards. As you've seen from many of the comments from the audience today, we're not there yet in terms of ensuring total compliance. But we are, again, myself and my colleagues in other MOs, and we regularly meet to discuss these issues, are tackling the issues that are causing confusion with the healthcare users. But it has to be noted that, as Elisa said, there are other applications of those barcodes across a supply chain. And if we can get to a situation where manufacturers understand that they can actually capture some of the information they're putting in other barcodes in that GS1 data matrix, or even that GS1 128 linear barcode, then hopefully we'll see less and less of their internal barcodes appearing on their products. And also the move towards a GS1 data matrix should tackle the issue where we have multiple linear barcodes, one above the other, capturing that information, because they do take up so much room. And a shout out again to Sage Tech Technologies, Sage Tech Medical, sorry, because that really is a solution that supporting the circular economy. And we've always talked here at GS1 UK about the standards being the enabler. I think we've seen that today, that through manufacturers adopting those GS1 standards, it enables so many other processes, which ultimately leads to improved patient safety, reducing unwarranted clinical variation, and improved operational efficiencies. And before I move on, let's just see if there are any further last-minute questions or comments. Okay, great stuff. Okay, so we are just about on time, I'm glad to say. So just a very big thank you to all of our presenters for taking time out of their busy schedules, some of them jumping out of a meeting only a few minutes before, others having to rush off for other meetings that have been scheduled last minute. And as my colleague Tasha says, thank you for joining us this morning. We hope you enjoyed the session. The slides, recording, Q&A and resources will be shared over the coming days. So enjoy the rest of your day, and thank you all again.